So, hello everybody, good afternoon. I'm Ivo Kree. I'm Director for Policy and Projects at Polis. I'll be the moderator for this afternoon's webinar in our series PT Lab, Public Transport Lab. And today we'll talk about overcoming barriers, inclusiveness in public transport systems. I hope you can see my slides, and I'll give it 1 minute more for people to arrive. So then we'll kick off the discussions and presentations. Okay, I think we're all set now. The numbers are growing. I also have, there were some of the speakers, I think, that have entered through the attendees entry of the webinar, so I've upgraded them. I have to know, I guess we are missing Stefan Talen still, so if you are here, please let us know in the chat. Okay, that was a bit of housekeeping, but welcome to this to our webinar. We thought it was important to dedicate some time to the important issue of inclusion in public transport in the series of webinars we are organizing as Polis to look at public transport in challenging times. We are facing the COVID exit or almost exit. We are also facing a transition in public transport in terms of digitalization, in terms of energy issues. So this all comes together in our webinar series, and today we talk about the inclusivity of the system, and for that we have 4 excellent presentations given by many more people. we'll hear about that. So first we will have an short presentation by Floridea Di Ciomo from Cambiamo, who's involved in the INDIMO project, who will talk about the human factor and caregivers' mobility needs. And then we have 2 presentations of case studies. The Vervoerregio Amsterdam, so the transport authority for the wider Amsterdam region, will talk about how they map accessibility or inaccessibility of the public transport system. And that will be followed by a presentation that explains the measures to support mobility for the visually impaired in the Ile de France region. And we'll conclude with some kind of a summary presentation about barriers, overcoming barriers to inclusion in public transport innovation from the side of the TRIPS project. But we'll hear about all these project names later. Just a couple of practical arrangements for this meeting. If you have questions or comments for the speakers, you can post them in the chat or in the Q&A. I will be monitoring that, and I will translate these questions or bring the questions to the speakers. And also it's possible to interact in writing with each other as participants or participants and panelists, either in the Q&A or in the chat. We are recording this webinar to make these recordings available afterwards. For the speakers, do not speak when, do not open your microphone when it's not needed. And we're also making a summary report. Isabel will be handling that with the key outcomes of the webinar, and that will also be distributed through various channels. So this webinar is conducted with the support of a couple of projects. Currently, the INDIMO project is an active project where we are looking at an inclusive system of mobility solutions, focusing also on public transport. And that builds on the outcomes of a previous project, the inclusion projects, where we have been looking at more accessible and inclusive mobility solutions for European prioritized areas. And the inclusion project was looking at all kinds of issues, and we have a small video for you to explain where that project has looked at.
How important is personal mobility for all of us? To be free to move and access everyday functions such as education, healthcare, employment, and social activities. For many people, however, the current mobility system does not function as it should, which often leaves them with considerably fewer possibilities to engage in society. Inclusion is a 3-year European Union-funded project that aims to address the challenges related to the accessibility of public transport in prioritised areas. That is, peripheral, urban and rural areas, where accessibility, inclusive mobility and equity challenges are greatest. Inclusion identified and analysed concepts and solutions that are already applied in European regions and elsewhere, and proposed a range of innovative and transferable solutions to ensure accessible, inclusive and equitable mobility for all, and especially for vulnerable user categories. In some deprived urban neighbourhoods or remote rural areas, having access to an efficient and inclusive public transport system integrated with shared mobility solutions means greater access to employment, educational and social opportunities. Different people can be vulnerable to exclusion for different reasons. This can be due to age, location, income, gender, ethnicity, physical or cognitive impairments, or combinations of these. As a result, there are many different mobility needs and varied solutions for addressing these needs. Inclusion measures were tested on the ground in 6 pilot sites across Europe. In the Cairngorms National Park in remote rural Scotland, a public-private partnership with local bike shops provided a successful and cost-effective mechanism for delivering an e-bike hire scheme, helping young locals access employment and aiding older residents to keep active and healthy. Flanders region in Belgium explored the potential of new app-based technologies for vulnerable user groups, including an app for elderly and disabled users to book a volunteer ride-sharing scheme and enable access to local services. In Florence, local bus lines were redesigned to improve connections with tram and train services for rural commuters and migrants in deprived peripheral areas. In the Rhine-Sieg district in Germany, the increase in afternoon bus frequencies and the reduction of single bus fares resulted in 5 times more trips of parents accompanying their children to primary school. In Budapest, the transport staff was trained to increase their competency in recognising and assisting vulnerable users. A crowdsourcing platform was designed to collect feedback and opinions by the users on transport services. The Barcelona pilot improved access to social and cultural events for young people, thanks to the provision of 11 new commercially viable collective bus routes from peri-urban and rural areas. This improved access to around 450 young adults and teenagers. Learn what steps your city, region or organisation can take for a more inclusive mobility. Find useful resources, tools and solutions at www.h2020-inclusion.eu.
So all these measures were the starting point of new projects, 3 new projects. So we'll hear about 2 of them. The TRIPS project, Dignity, which is not on today's program, and the INDIMO project. And the INDIMO project is will be represented by Floridea. Floridea, I give you the floor. I think you can explain well what the project is about and what you are specifically looking at in this context. I will stop sharing and you can share the screen then. Yep.
Okay, thank you very much, Ivo. I start to share the screen. One sec. Okay. So this, okay, the INDIMO project, the title of this project is about inclusive digital mobility solutions. And what we did during this first year and a half of project was to define the framework and started to getting the insights from our target groups. Some of them are similar to what were defined in the inclusion project, but some of them are a bit different, and especially the difference is that we go deeply on the barriers and capabilities and requirements that people are asking for using these new digital mobility services, including passenger services and goods delivery services. So this is where we are. This presentation is the result of a huge work done by people from Cambiamo, because we were leading the part related to defining the main requirements for inclusive digital mobility solution, but as well by all contributors of task 1.3. There are more than 50 persons who were involved in the ground work in defining in doing the interview with the user and non-user from target groups of INDIMO, and in building up and launching the community of practices that is a space specially created for including and putting together people from different perspectives, user, non-user, but as well policymakers, end users, and stakeholder representatives, and so on. So just so we go a little bit more faster on the where is a little bit the initial, I don't know if okay, you can see well the presentation. The main point where we came from, like Cambiamo, and why we are in INDIMO as well, is that from some years, I think that already like 5 or 6 years, we are working on the care mobility, and we are. This is quite a personal fighting that we would like that people and the planners accept that mobility for caring is a key important purposes, and it's even more than mobility for commuters, and that so they deserve this purpose, deserve a much more attention. Some insight from inclusion presentation is coming when they talking about how to join activities related with the health, with the school, and accompanying children, and so on. All that is care mobility. And we started to work just with the number within the 2 main survey, one in Europe, in a metropolitan area of Barcelona, and the other one in Ohio in the United States. And we found that 40% of daily trips are done for this kind of purposes. And even during COVID time, this percentage was increased until 60%. So maybe we need to really to give attention to them as well when we plan the digital mobility, or we would like to regulate or to decide which kind of digital mobility solution accept or not. And if this is just a slide about where we are with the mobility and the caregivers, most of caregiver care issues are done as well by women. This is a fact, even if we have some difference between, for example, European countries and the United States, where the men are more involved in the mobility for caring. And even in the northern countries region, we found that where the share in the tasks at home is more equal. When we are going on the mobility of caring, most of this mobility of caring is on the shoulder of women. So this is was a little bit just a frame that we can see. And what means that if we have a transport system that is especially oriented for mobility of commuters, maybe we lose some part of the story, and this part of the story is 40% of the transport, of the mobility. And so we go on the notion of the needs, that is like a basic notion for understanding as well who is benefit from the current system, who can be advantaged with a different new system. And we think that it's clear, important to make needs visible. This is the essential part of the for identify where which mobility is needed by different kind of purposes, in this case for mobility of caring. So in the INDIMO project, we started from this notion of the citizen needs, and we think that for eliciting needs and for design and digital mobility, it is like the pillar for creating this universally inclusive, accessible, usable mobility, digital mobility. I would like just to stress this word of universally, because INDIMO project is based more on qualitative methodology, using, like I said, semi-structured interview and a community of practices. And just because we think that we don't need to go with always with the majority, but for designing, performing, and needs responded as a transport system, what we need is to take care of all kind of characteristic of people. So
Florida,
we go, yes,
just
I need to go, yes.
Yes, you are at slide 2, and you have already spent a lot of time. Yeah.
Okay,
So,
I'm going quickly. So what we did, this is the methodology that we used with the semi-structured interview and community of practice, like I said, with the thematic analysis. And finally, we found more than 80 requirements, and the selection of them that we have like 50 requirements at the end of the story.
Sorry to say that I don't see the slides moving. I see maybe it's me, it's my screen, but I see the slide called "We basically move for caring."
Okay.
And I think
don't know
you have.
Why.
I don't know if others have the same problem.
I don't know. 1 sec.
Yeah.
Now?
No. Shall I show, or somebody of my colleagues show the slides for you, maybe? Hopefully, because we.
I don't know, because I have the same slide in the 2 screens that I have, and I.
Yep.
Now it's okay, no?
No, it didn't move on. Maybe I also, the audience says that they see the same slide, so that's also why my comment was maybe a bit strange that I said you are not moving on.
Yes, no, I was moving on.
Yeah. Okay. Okay. Now it disappeared. Somebody else is sharing the screen. Okay. Good. So if
you can go on the slide 6. please. If you can put to duplicate the screen, or otherwise the audience see the slide in the second one.
Yeah, you have to change the display settings.
Yeah. Slide 6 and in mode presentation.
Sorry for the technical hiccup.
It's okay.
No.
Just if you put in presentation mode and go to the slide 6. Otherwise, I can stall.
Yeah, I will take it over. I will do it.
Okay.
Yeah.
Okay, just I go into my presentation on myself and and this way. Okay, so like I said, if we have the chance to go to slide 7, we have this list. It's okay, Ivo. I will talk, and maybe people are able to follow myself. I will try to explain better. So we had this. So like I said, the needs is the key aspect of this. The starting point of the project, and what we found, so like I was saying about the universally and inclusive, accessible, usable, and the fact that we don't need to fix always on the majority, but on the covering the different characteristics and needs of people who are not the majority. But in this way, we are covering in a more universal way. If we cover in more universal way their needs, we are able to cover as well the needs of the majority. This is why we use this qualitative approach. And then the insights from the fieldwork are defining, are oriented to mitigate barriers for using digital mobility services, and this is where we are. And for whom is important this kind of insights? They are important for UX, UI designer, computer programmers, operators, policymakers, and so on. Like I said, the qualitative approach was including semi-structured interviews, community of practices. I don't know if you are familiar with the concept, but it includes a different perspective of user, non-user, and policymakers, and the representative of users. And then I would just to go to this key point. What we see is that the most of the needs defined in the aspect of the is this slide. I don't know, Ivo, if you are there. It's the slide number 7. Most of needs are related with the space and time, but we have that is quite common in transport.
Yes, we're here. We're here on the slide.
Perfect. Yeah. Okay, great. But the key point in this time was more the human contact. That is quite different from what we expected, because we think that when we are in a digital world, we are able to take out the human assistant. And what target groups of people said to us was that it was important for them, the human contact. Next slide, please. And this is some thing that we can find across all the groups that we analyzed, including older people, rural, digital, no digital connected, caregivers, women, and so on. We will see it afterwards. And is that there is not they need a kind of self-empowering. There is a self-empowering intention. This is important because when somebody would like to learn something, it's easier to do that. And the digital, no digital native have more difficulties to use the apps. This is quite normal, but it depends where they are. For example, older people, but it depends where they are located. And then another aspect that is important is that there is still a digital mobility gender divide when we add a new aspect of the technology that is the digitalization. And the current mandate is internalized even by disabled people. This means that people feel not comfortable when the people with reduced vision, for example, feel not comfortable when they need to cross a street because they feel like guilty and because they are low, a little bit slower. Next slide, please. What we here you can read all the characteristics of all the capabilities of that we identify for each for each target group. We have 12 main characteristics of target groups. Please, next slide. And we focus in this presentation on what were the caregivers of children and women. And when we see their capabilities, there is the use of mobility apps is in some ways for searching some autonomy. This is especially for women coming from the socially isolated group. There is an attention to security concern, a condition for mobility of care. And then when we go on the caregivers of children, we see that they can be familiar. They are quite familiar with digital mobility, but because of course, when you are caregivers and the transport system, traditional transport system is not answering to what you need, and you have a novelty coming from the digitalization. You said, okay, this is my solution. And so they are familiar with this kind of tools, but they see that sometimes they are not very well, they feel still that they don't have the right answer from these digital tools. So they need, they have this good information about they need this good information about the availability of the option and so on. Next slide, please. Yeah, next slide. So when we go on this, when we do this requirements path, that is related with women and caregivers of children, we can see that the requirements is the difference between what people are able to do, the capabilities, and their limitations. And what if we focus just on caregivers of children, what they do is a common use of the channel trips and with the middle activities. So they're where they are now, and they have a positive view on ride sharing when it is the right equipment. And but at the same time, they feel the pressure for delaying the services because of the children. So for example, if somebody is already in the car and you need to pick up a service with the ride hailing, they can feel a little bit uncomfortable, and they feel uncomfortable of disturbing other passengers. So this is what is the requirement there, and then I finish, is that we need to include the information about child seat and extra space in the vehicle, and the possibility of ordering the services in advance, and as well to call the ride or driver to arrange a place for the pickup to be more safe. If you go forward, just we go directly to the conclusion, to the discussion, the conclusion. This is just the presentation, the discussion. This is important. What we observe in the this was in the case of Berlin, where we deal with we have 5 pilots in the INDIMO project. One in more on digital lockers, one on the digital delivery food in Madrid, other one is on smart lights in Ambert for elderly people and impaired people, and another in Galilea with the ride hailing for women and ethnic group, and in Berlin it's just for women and caregivers. So this is the most the example that fits more this one. But transversally analyzing these 5 pilots, we can find that mobility and physical disability, the assistant could be a twofold, could have a twofold could be twofold aspects. On one side, there is this intention to be empowered to use by themselves the application, but as well they don't want that some application do things for them. So for example, they still want, the blind people still want to go to the shop and not to have the goods at home always. And then there is some what we had was we had some difficulties to recruit people with very different characteristics and with these intersectionalities of characteristics. And of course, we need to still continue to adapt the mobility, digital mobility services to what users are asking for. Next slide, please. How to reorient this planning. Next step.
Yeah, Florida, you really have to conclude, yes, because
yes, I conclude.
Yeah.
Okay, we need to translate these needs. This, I think that just a couple of examples. One is Paris, is very well known. Another one is more less known, but it's in Valladolid, where they adapted the frequency of public transport during COVID time with more frequency, even if they were in a COVID time. And next slide, please. And just this is a final slide, thinking that rethinking the ways in which women participate in the digital mobility services and labor sector, because we found as well through the methodology of community of practices that we know better from people who are suffering their needs than people who are experts. So this is one thing. And another thing is maybe we need to relate on the counterintuitive than on the intuitive and majority trap, and in order to rethinking how to organize the services. I apologize for these technical difficulties, and I hope I'm here for answer to your question, and you can see in the presentation that Polis can share with you if we have some additional input. Thank you very much.
Thank you very much, Florida. Yeah, pity of the technical issues, but I think you brought a very rich story, which is of course much more elaborate in the slides and in in the material you can find on the INDIMO website. So I think really expanding the target audiences that we consider for inclusiveness in public transport is a first lesson I draw from this. So also the care to include also the carers. That's something you have mentioned. Even when talking about digital support, keeping the humane factor in place is also a very interesting insight, and also this idea of solution trajectories that you presented, the different pathways for solutions, building on the capacities of the people, and also the system characteristics. I don't see any questions in the chat, so I leave it up to the audience to write some write questions to Floridea. I saw a hand raised by Eddie Healis. I hope you can follow up in writing, Eddie. And we have to move to the next speakers. Two speakers from the Vervoerregio Amsterdam. So that's the authority that has been established to manage public transport and beyond in the wider Amsterdam region. And with us is Stefan Talens and Huub, which last name I'm now going to figure out. Sorry for that.
Hunyet.
Hunyet, yeah, it's even for somebody who's Dutch speaking, it's not a very common name. That's so Huub and Stefan, I give the floor to you. I hope you can share your presentation. Normally you should have the abilities to share slides, and then the floor is yours for about 15 minutes. Yeah.
Great. Small introduction first. My name is Stefan Talen, project leader at Vervoerregio Amsterdam, the Transportation Authority of Amsterdam. And we prepared a presentation about our data-driven approach for the accessibility of the public transport network. Huub, my colleague, he will provide you with the slides and the presentation, and at the end I will provide you with a demonstration of the tool. So I give the word to Huub.
Yes, thank you. First, let me check if all can see our presentation right now. I get a thumb up from Stefan, so I guess everything's all right. Well, thank you, Ivo, for giving us the floor and also explaining already what the Vervoerregio does. That gives me some more time to explain what we did to well, make transit stops in the Amsterdam region more accessible. We had a problem, so to say, of unknown size, and we wanted to develop a method to tackle this problem. So, well, we started with that 1 year ago now. So we take you back to 1 year ago and show you the steps that we took to solve this problem.
I'm mainly curious whether I see your second slide, and that works great. That's the biggest question. Yeah, good. Okay, so yeah.
In the next 10 minutes, we will show you how we solve this problem. And we did so using an existing framework of data about the transit stops in the Netherlands. We did a lot of field work, and in the end created an adaptive dashboard that will help us addressing the problem at hand. Well, at first, an introduction why we did this and why we made it a priority. We have a shared ambition at our organization to well, make the transit in our area, but not only transit, but all traffic more accessible for everyone, more inclusive, and well, make the experience for the user as good as possible. And in the past, we already improved a lot of stops before. That was the easy part, but now there are still a lot of stops that are not accessible enough, and it could be a priority, but we didn't know where they are. So it's not a walk in the park. It's a data problem. It's a priority problem, and well, we had to figure that out. So the keywords are speeding up the process to reach the stops that have the highest priority, improving accessibility, and do it together with our municipality partners. So what makes a public transit stop accessible? There is a huge list on the right, which is all in Dutch. I will give some translations for you to understand. But it's mostly based around national criteria. So there is another organization in the Netherlands who makes a lot of, well, not rules, but guidelines how to organize design of public transit stops, but also roads. And they have guidelines about how to make a public transit stop accessible, both for motorically impaired, but also visually impaired, and other types of disadvantages for people. That's the official part, and we also wanted to include people with a temporarily injury or carrying a lot of luggage, but also traveling with kids. So we came up with a huge list of criteria to judge the stops on, which are all part of like broader teams. So you have the alignment of the platform with the surroundings, which means that the road towards the stop is flat and it's easy to access the platform. There are guidelines for blind people. And on the second category is that the platform itself is usable, so there's enough space to maneuver. There is line markings for the whole stop, and there is a place that is marked as a place where you can enter the vehicle. And the third team is getting the vehicle alignment with the platform correct, which means it should be high enough. There is room to step in and to step out. The edge of the platform is marked, and all kind of other markings. And the fourth category is a category we added ourselves, so it's not in the official guidelines, but we thought what makes a stop really stand out from the rest, that's also to have the right services. So shelter if you have to stay for a long while, or having lights in the evening, being able to sit down, or well, lean into support, and very important in the Netherlands, of course, having bike parking facilities. So that's the whole list of measures we use to grade the stops. The approach was 3 steps. So we needed the data bank of all stops in the Netherlands to be accurate and recent. So we gave the an organization we said you should go out there to grade, not to grade, but to check all the facilities and properties of all the stops in our region. So we got a lot of new data to grade our stops. Then we needed a method to prioritize. So what makes a stop score high or low, but also what other properties are important to change one stop over the other. So does they have a lot of passengers? Do they have a lot of bus lines coming there? And is it close to schools or healthcare institutions? And in the end, step 3, how to make the data accessible and interactive. We used Power BI to create a dashboard, which helps a lot in interacting with the municipalities, who are, of course, the ones who have to work on the physical infrastructure. So step 1 was about auditing all the bus and tram stops in the region. That gave us 15,000 pictures, which I'll show a few of them a bit later on in the presentation. They also measured the height of the platform and the length of the guidelines. They gave us all the information we needed to update the data bank of all the transit stops. And on top of that, we also found out that the criteria to make a stop accessible would be stricter. So they started this year and would make only 41% of our stops accessible enough to pass the criteria. So it was clear that there's a lot of room for improvement. Well, then we had to grade them using our method I explained before. It's not yes, it's accessible, or no, it's not accessible. We wanted to have an indication how accessible it is. So it could be right for a certain amount of criteria, but not for 2 of the other criteria. And for instance, it would score 7.5. We also discussed this with specialists, both experts and people who are disadvantaged themselves, so they could assign weight to the different factors we used to well, to decide if it's more important or less important for accessibility. And below you can see that of all the stops in our region, the diversity of the grades is very high. So you see quite a lot of stops in the upper region of 8 or higher, but also a lot of stops in the lower region below 6, which is a passing grade in the Netherlands. So a lot of stops that have a lot of room for improvement. And those are not only the stops where a few buses stop in the per day in the middle of the countryside, but also a lot of stops in Amsterdam itself, which are very highly used. So yeah, as I said, a lot of room for improvement. These are a few examples of pictures we got from the field work. And on the left side, there are 2 stops that got a pretty high grade. So you could see the elevated platform height, markings alongside the platform. In the background, you see that there's also a shelter. And on the right side, you can also see there's a bikes parking facility. So these are 2 examples of stops that are also pretty recently already improved. And on the right side, it's a pretty telling picture of a stop that didn't get a high grade. It's a bit cut off, but you can see that the pavement is just continuing into the stop, and there's no marking for visually impaired people. While right next to it, close to the stop, there is a ramp for someone who well lives in the house right in front of the stop and is probably in a wheelchair. So she can enter her own house or his house very easily, but not get into the bus that's right in front of the house. So, well, there are a lot more good examples of stops that could use a bit of improvement from all the pictures that we got. And then there's step 3. We have to communicate with the municipalities, and well, for that we developed a dashboard that Stefan will explain right now.
Okay, thanks for the first part. I will try to share my screen in, let me see how this works in Zoom. It's here. I think it works. Click share. I think everybody has access to my screen right now.
Yes, we can see it.
Yeah, you can see it. It's currently, I think it's open in Power BI, but it's an online dashboard. So it's you can open it in any internet browser, and it's well, we made it actually to make appointments with all the municipalities. We have 15 in total, and every one of them well, needs to be convinced. It needs to be convinced about, okay, there is a problem. We need to arrange finances for this, and we need to know what to do to improve the actual bus stops. So therefore, we made this interactive dashboard, and I'm just going to walk you through in a short. How much time do I have, Ivo?
Let's say about 3-4 minutes. Yeah.
Should be doable.
Yep.
Okay. On the left, we see was actually the owner of the bus stop, and we see the municipalities. We can look for bus stops. We can select on, like, is it a bus, is it a tram, or is it both of them? The combination. We can select based on the amount of passengers, the grade system that Huub just explained. And we can also check if it's just, because indeed we say accessibility is not a matter of black or white, but actually it is. You meet the criteria or you don't. So that's also a possible way to select. And an interesting part is here in the middle, we see some general key performance indicators, like the amount of bus stops that are accessible, that are limited accessibility, the amount of bus stops in total, and the amount of passengers per bus stop in a municipality. In the middle, we see a list which currently is pretty long, but I will filter it down in a bit. Of all the bus stops, we see them on the map, which is very easy in talking to civil servants with a very local perspective. And in the bottom, we see the grading, which is split down into like getting from the platform into the bus, or the platform itself, or the other criteria that we just explained. So, for example, now I'm in a meeting with one of the municipalities. I can select all of them here. So, for example, I select Wormerland because I'm trying to look for the one you just saw in the picture. We see them here. We see how many bus stops they have. They have a total of 60 bus stops in total, and a lot of them are not accessible. I can select them based on how many passengers we have. We see them over here. So what are the highest ones? What is the most important one? And then from here is really a cooperation with the municipality, because for me, these names, the names of the bus stop, the names of the street, it doesn't tell me anything because I've never been there. But in a meeting with actually the public servants of the municipality, we can clearly see on the numbers, the grading system between 1 and 10, like what bus stops need to be improved. Okay, let's, for example, select this one. It receives a 5. Let's see where it is. We see it's somewhere along the street, and it's very easily, because we told you earlier, we received in total of 15,000 pictures. These are directly linked. So if can you still see my screen, or nothing happened when I click the link?
Yes, we see the screen. Yep.
You see? So so you see the picture now, or you don't?
No, we see a map and we see the.
Okay, check, because then I need to change something quickly. Okay, because it opens in an internet browser.
Okay, yeah.
Switch from a window.
Yeah.
You should be able to see it now. So you see it directly points me towards the local situation, which actually for me is not really like a proper indicator, but for the local civil servant in there. It's really like, but I know this place and it's close to some important location or not at all. And what do I think of this? And then maybe I need to talk to my how do you call this actually, the mayor, to arrange finances to help these bus stops improve, to increase the height, to give them shelter, to give them whatever they need in order to be accessible for blind people, for people in wheelchairs, for people with other kinds of disabilities. So yeah, this is actually in about 2 or 3 minutes, I think, how the demo works. So I stop sharing it now. If there are any pictures, we are most happy to answer them. But this is our way to convince all our municipalities to increase the accessibility of public transport.
Yeah, great. I have a question. You are also in charge of the routing of the buses, no? So it's the vervoerregio who then makes sure that there will be a bus at the location of the stop. I mean, that the investment of the municipality will also be worthwhile because you commit to having public transport on that route for a couple of years. Is that correct?
It's partly true, not fully true.
Okay. Yeah.
Because in the Netherlands, we put the requirements for, like, we want these kind of locations to be connected, and we want so many buses an hour, but the exact routing of the buses is done by the public transport operators themselves.
Okay. Yeah.
So indeed, it did happen, and it can still happen that you improve a public transport bus stop, which will be 2 years later, for example, no longer receive any buses. Yeah. It's a pity. I see your point, but
yeah. Okay, I have a question from Tali who asks the actual relation between the single digit score, right? So the 1 to 10 score, or the 0 to 10 score, and the actual list of indicators. So the different characteristics. So is that a formula you use? And do people always have to go back to the actual scoring to understand what needs to happen? Or does the actual single digit score, the 0 to 10, give some kind of indication what should happen?
The 0 to 10 is indeed some kind of indication which can help you prioritize. Like, for example, I do the lowest ones first, the really bad ones, but it's just one way to prioritize. In the end, we are only there to motivate the municipalities to start doing this. We can help them with subsidy, but we can't tell them what to do. So, for example, they can also do it based on another criteria, like, for example, is there a hospital nearby or something else? And the second part of the question is whether the grade gives you indication of what to do. That answer is clearly a no, because we are not the technical experts. Because, for example, if you have a bus stop in the middle of the city center, it's easy to say, oh, it's not high enough according to the criteria. But to increase the height and what you need in order to do this is something that should be done by experts. So therefore, we hired a party from the market who is really an engineering firm that could help the municipalities further with this, what is actually necessary.
Okay.
To expand on that,
yeah.
The number is broken down into 4 like sub grades that actually tell what's the issue with the stop. So if it gets a 5, it could be that the facilities on the stop are good, so it gets a high score for that, but it gets a terrible score for alignment with the surroundings. So they could say, you should add a guideline towards the pavement so that a blind person can get safely to the rest of the neighborhood. So that's clear from the scores, but like Stefan said, it's not clear what improvements are actually necessary and how it's done physically. So they can already get an indication what's the problem with the stop.
Yeah. Okay, yeah, I can ask 100 questions, but there's no time. But there's a question from Rita also, who asks whether there is a policy about whether or not to have an intent a bay for the bus to park, or whether you actually stop the bus on the road. So if that if that is based on design principles, or if that's more random random issue linked to the context, or
It's an interesting question. I don't know if it's very related to like the accessibility of the bus stop, but I see the point of the question. I'm not the one to answer this specifically, but I can imagine it's a balancing of interest between like the speed of the other traffic on the road and the price of this bus stop. So if it's on the road with a lot of traffic, you don't want all the traffic to stop because the bus needs to stop.
Yeah. There's the swinging of the bus also when you have to, which is not always comfortable. Okay, I have one final question before we move to your colleagues in the Ile de France region. Is there an interest from the political side in this? Are they concerned by the accessibility of the system? And if so, are they happy with just having a monitor like you have provided, or do they also want progress in this field?
They are definitely involved in here. It's a big part of our policy documents for inclusive mobility. So we have many projects, like for example, we have they're also building an app to help people even better to see what bus stops for them are accessible, yes or no. So there are many initiatives at the same time, and this is just one of them. I would like to put a small correction, because this is definitely it is indeed a monitor of the current situation, but it's not just used to monitor. It's really used to help the municipalities, like what is the size of this problem actually, and what needs to be done to solve it or to make it better. You know, maybe it's not always possible to make it perfect, but then what can be done? So it's definitely the idea to make
so for an action tool also. Okay, then I think Stefan and Huub for the presentation will also make that available. I don't know if there's, so the tool, if people would click on the link in the presentation when it's shared, it works also.
It works,
that's
except for the pictures, but the rest works.
No, that's good. So they can check that out as well. Okay, we go south to the biggest public transport authority of the continent, I think, Ile de France Mobilité. We have a short introduction of Françoise Gaspard, who is the Brussels office contact for transport and tourism, but today it's about transport. And after that, we have Robin, who will talk about, Robin, who will talk about an application for people with visual impairment. But Françoise, a quick scene setting from your side, please. Yeah.
Thank you, Ivo. Thank you for having me today. I'm very pleased to be with you and to introduce you, Robin Legal, CEO from INDIMO. So a few words about the context. Each year, Ile de France Mobilité launches a passenger information challenge. This challenge is a competition open to all stakeholders wishing to propose innovative solutions. So this competition is open to startups, to SMEs, mobility stakeholders, in a view to tackle passenger information issues, and INDIMO won the last edition. So this edition focused last year on responsible mobility, and candidates were asked to work on solutions that address current health, social and environmental issues that meet travelers' expectation in terms of information. So this is how in Ile de France the Transport Authority promotes innovation, and another good example of how we can strengthen public and private partnership. So I'm very happy now to give the floor to Robin.
Thank you. So
Thank you.
I will share my screen.
Yes, and please, we have 10 minutes. I'm a bad time manager, but I hope you do better than me. Yep.
Okay. Don't hesitate to cut me if I'm too long. Thank you very much. So thank you for having us here. So first, I'm going to explain who we are at INDIMO and what we do, and then focus a little bit on how we worked with Ile de France Mobilité and what came up with. So first, I will present the team. So I'm the CEO, and Camille and Julien are the co-founders team. We are a multi-aspects team that, because we believe in inclusive mobility and we believe in the use of new technology for a greater good. So we build a team around those values. So here's a team. I wanted to show you the face of our team, but together we face one problem. The problem is for vulnerable people in the transports, how do they take the public transport? And I would like you to imagine for a second, would you be able to take the public transport with your eyes closed? Would you be able to find a door to enter the train? Would you be able to find a seat without sitting on someone's lap? Would you be able to exit at the right stop and then navigate within the corridors? So we believe that mobility is the key of social life. We believe that mobility is the key of employment. We simply believe that mobility is the key for all, is the key of life. And that's why we are here today at this webinar. So I will present you the INDIMO solutions. So at INDIMO, we built software solution for an inclusive mobility. Our goal is, by using technical solutions included in mobile app, we want to enhance accessibility for all the vulnerable people, and at first for visually impaired people. We want to build autonomous solution. That means no installation on the public transport and no device that has to be used with the app. Our goal is to improve time efficiency for the users, because that's what we do when we use an app in the public transport. We want time efficiency and we want reliability of the information. And that's what we created with the INDIMO solution. To sum up a bit what we created with INDIMO, we created three packages. The first one is INDIMO detection. So INDIMO detection include different type of detection of localization of infrastructure that are the most needed by vulnerable people in the public transport. So first, fare gate localization, when you have to use your ticket to insert in big hole and big places in the stations. You have to find empty seats localization, and you have also to find a door to enter the train. So for that, we use our smartphone as a scanner, and we are scanning, the user will scan the environment, and the app will provide haptic and audio signals to help you find the infrastructure. We also provide a journey package that will allow applications to propose accessible journeys and to monitor stops within a journey. And the last one, but not least, is the INDIMO guidance, which provide in every app an indoor step-by-step navigation in the public transport. So we built those packages and we integrated it in an app that we presented at the challenge for Ile de France mobility, and that's what we are going to talk right now. So the challenge Information Voyageur, so information challenge with IDFM. The main goal was to deploy our solution on the Ile de France region and fix the last detail in collaboration with the users and with the IDFM. There were two different steps. The first one was the improvement of the user experience and validation of technical choices within the app. That was very important to pass a security check and to pass the user check. That was the most important thing. So we just passed those checks just the month before. And now we are in deployment and usage analysis, which simply allows us to give the opportunity to more and more testers to use the applications to verify that it can handle a lot of passengers and that it fits all the needs. Here are some KPIs that will bring you how good was the deployment with Ile de France Mobilité. So the first thing we wanted to be sure is that the app is accessible numerically for all. And we got a 97% accessibility rate, which is really nice. And we wanted also with the UX validation, we wanted to validate that there were intuitiveness in what we built. So 89% was a very good mark, so we are happy about it. We built this solution with the user from the start. So we wanted to be sure that it still fits their needs because we are working with them. And the promoter score of the application is 9/10. So it's recommended by the user, and every day we get new users coming to test the application. We validated that our features are useful and that they want to use it. And with a little bit of technical information, we got more than 94% accuracy of localization algorithm on all the network infrastructure, not only on one type of bus or one type of train. We have this rate is on bus, metro, tramway, and RER in Paris. So I wanted to talk about what was the relation with Ile de France Mobility. So first, I would say one word. I would say reliability. We set up a regular steering group with Ile de France Mobility that helped us understand what was their need as an accessibility solution on their public transport. Ile de France Mobility acted also as a facilitator. It helped us find the right spots to test our solution and to get the authorization to go there. And because we didn't want our solution only to be deployed within this challenge, we wanted to go further and to deploy it afterwards. Our contact on the Ile de France Mobility part gave us the contacts on the tech team, on the development team that will help us as a startup to grow and to fix and to deploy our solution within the Ile de France Mobility app in the future. Where are we? What's in the pipe right now? So we're talking about the next step with Ile de France Mobility, which is a great discussion, and we are still going with it. We are also in discussion with several cities in France because we don't want only to deploy in Ile de France, but we want to deploy in many cities in France. We are speaking to more than 20 cities in France, and we want to go outside of France because our system can be implemented in any type of transport. We are also included in several call of thunders. So thank you for listening to me. Together we can build the city of tomorrow, and thanks to Ile de France Mobility, we were able to deploy our solution on the Ile de France network. So if you want to contact me, there are my contacts here. And if you want, if I got some time left, I can show you a video of how the solution works in the field. Would that be okay?
Yeah, that would be okay if it's not too long. So then
it's 1:40. It's okay.
Okay, great. Yes.
Okay, that's just an explanation to show you how it works. How to find a train door, how to find an empty seat, and how to get out of the station. Fabien, let's use the EasyMob app.
EasyMob. Allons-y, Fabien. Direction Bobigny.
There you go. Thank you for listening to me.
Okay, thank you very much. I'll have a look at the questions and the chat, but there's nothing, no questions there. I'm wondering, so what's not entirely clear from the presentation or the video is the kind of databases you need to access. So what kind of data you would need to make this possible, and also to what degree you are dependent also if you would move to another location, which it has maybe less reliable data, or to what degree that would then increase the challenge of implementing this. So.
Yes, thank you for the question. So we have to separate between two things. The first things are the localization, as the localizations, infrastructure localization. So for that, we need a small time of setup to set up all the algorithm to verify it works, and then to deploy for like 4 months on a specified area. And then we can move on to deployment to the whole network. As you said, we use data, and we are so lucky that in Ile de France we have an open data that is really rich and gives us a lot of information. The thing is, this is only for the journey part and only for the accessible journey. So we just base our system on the data that are already available, so we don't create our live data and open data.
There's two questions which are also quite interesting. It's about the interaction with the outside world, let's say. In both questions, the first one is, of course, that you how does this relate to the accessibility of the public transport system in general in Ile de France? And maybe that's a question for Françoise. And then the second question is a question like, okay, what is how does this relate to training of the individual? I assume you use this as a support, but you also need some basic capacities in terms of navigation, etc. Maybe Françoise, you go first about general ambitions of the region in terms of accessibility of vehicles, infrastructures.
Thank you, Ivo. Yes, we have developed an accessibility scheme with high-level ambitions to have the public network all accessible. And today, I think for the buses, all vehicles are accessible in Ile de France, more or less. In Paris, it's certain. I think that we are almost ready to have all buses accessible for the disabled people. And we are working on the stations, on the railway station, and what we try to do is to that all stations will become accessible. Of course, the criteria are the European Union criteria, so it depends on the number of travelers. All the stations will not be accessible. In the France, it's not possible. The criteria is the number of travelers per day. And so we have this accessibility strategy for all railways, tram, buses, and also for the renewal of the vehicles.
Mm-hmm. Okay, thank you. And then maybe the last, Robin, and small point on this aspect of training and the the relation with the app.
We wanted to, thank you for the question, because of course we have to understand something is that by building these solutions, we never wanted to replace a cane, a dog, or something that is used for understanding what's around. What we built is like a GPS. When you use a GPS in a car, you have to know how to drive. that gives you indications, and that's what we do with our solution. And of course, it needs a little bit of training, but we included in the app and in the solutions, we included a small tutorial that would help a user within less than 3 minutes understand how it works. Of course, it has to train, but it understand how it works and can do the tutorial whenever he wants to improve the skills. That was very important, and one of our user asked us for this, and it was a great question.
Okay, thank you, Robin.
I think perhaps, yes. Just to follow about the question about the involvement of the user, Robin, I think that the user are involved since the beginning of the experiment.
Yes.
It's very important part of the experiment, of course. I think that, Robin, you can perhaps follow on this, but you can do nothing without the users, I think, to tackle the challenges.
Yes, that's the key point. The experimentation that we created, we teamed up with a partnership with one of the biggest association of visually impaired people in France, the UNADEV, and that helped us create our panel of different testers and to understand the results. And we built the solution with the user since we started the project 3 years ago. And now the users are still in the centers of how we created the solutions. To be honest, when we first started the experimentation, because we wanted to be so good as the user experience, we did every week we did like 2 or 3 tests. The development were made, and the week after, other testers tested the new upgrades on the app. That permitted us to evolve really quick and be now ready to deploy in every public transport.
Okay, thank you. Sounds good. There's also the offer in the chat to actually cooperate on a concrete case somewhere. So do answer to Tali, who is the next speaker, by the way. François, if you could also take a look at the question in the chat from Anton Koch. That would be nice. I think that's something that can be dealt with in writing. Okay, thank you, Robin and François. So we move to the last speaker, 2 speakers even. So there's Tali Hatzakis from Trilateral Research and Elvia Vasconcelos from the Technical University of Eindhoven. I have to say, I took a look at your presentation, so I don't know how you will manage to keep this a bit concise, but I'd count on your professionalism, which is bigger than my timekeeping capacities, to give some kind of closing remarks to what you have heard, also based on the TRIPS experience, a project which is running in parallel with the INDIMO project. So I don't know if we can manage to get a full screen view, because now I see another view, but yeah, this is better. I give you the floor for about 10 minutes so that we don't run too late. I know how much slides you have, so I hope you manage. Tali and Elvia, please go ahead. Yeah.
Okay. Hi everyone. Can you see me? No. Yes.
Yes. Yep.
Okay. So I'm Tali Hatzakis from Trilateral Research, and I will introduce the project, and I will let you. Then we'll follow up by Elvia, who will talk to you more about our processes. So today's presentation about overcoming barriers to inclusion in public transport innovation, which is what we're focusing on. And I would like to give you just 1 minute to ponder what this means from your point of view while I'm introducing the project. And if you would be so kind to just put a couple of your instant thoughts, what does it overcoming barriers to inclusion mean to you? So don't be shy, just have the first thing that comes to mind from your point of view. Okay, while you put your thoughts together, let me introduce the TRIPS project. We started last year a Horizon 2020 project that the main focus is on developing a new approach to design transport systems that are free from mobility barriers. We have included the website link here, so after the presentation, feel free to see what we are all about. So, but quickly today, I am going to discuss 3 of the key pillars of the project. One is how we prioritize the engagement of people with disabilities from the get-go, much like Robin was talking about before. What does co-design mean to us and hopefully to you too? And what does co-design means in practice, and how maybe there are things that we can share our knowledge with you in your journeys for developing inclusiveness and accessibility. Maybe the next slide. Thank you. So in our project, we took the stance that inclusiveness requires inclusion of the users in the process of innovation from the beginning to the end. So in the TRIPS process, we invent the co-design and co-creation methods with disabled people for disabled people, and we engage them from the beginning, not only in the user's requirement and the prototyping and the business case development, but even in the prioritization of what we should be focusing on. We also make it, we set KPIs to the rest of the people in the consortium around how well we can support them and how well we can build their confidence and give them the tools for them themselves to lead the innovation process. So for us, it's about empowering them to do it for themselves and to do it for us, because we felt that solutions that developed by disabled people will actually be good for all of us. So I will leave you now with Alvia to tell you more about the details of our approach in practice.
Thank you, Tali. So building on the first point about how TRIPS has been engineered to prioritize the engagement of people from the get-go, the second key insight that we would like to share with you today has to do with what we mean by co-design in TRIPS. So co-design can mean a number of different things depending on who you ask. When we started TRIPS, we created a document that defined what we meant by co-production, co-design, and co-creation. And so we work under the umbrella of co-production, which is the why, the ethos, and the overall approach. This approach makes use of both co-design and co-creation. And co-design is really the how, the tools, and the strategies, the practical strategies. And co-creation is the doing and the production of an explicit design material. Halfway through the first year of the project, we wanted to build on these initial definitions to create a shared understanding of what co-design and these definitions mean from those involved in the project. So we asked everyone to complete these 3 sentences. The first one, co-production for me is about ... The second one, for me, doing co-design for real looks like this. And in this project, what is most important to me is this. And so I'm going to share what came out of these questions. So for those working in TRIPS, co-production is about whose voices are heard, emphasizing that the voices of disabled people need to be heard louder. Co-production is about doing things together on an equal and meaningful basis. And co-production is reliant on having a common vision that builds on the strengths of all involved in the project. When asked what co-design for real looks like, people responded that it was about specific and tangible actions with results that reflect the conversations that they come from. So essentially, people want to know that they're being listened to and that their work is contributing to change that they can see and feel. Practically, this looks like a guided end-to-end design process of exchange. And this is an ongoing thing that requires a multitude of working processes. And lastly, co-design for real feels like having ownership of the process and being fully engaged in the shaping of it. The final question asked people to reflect on what was important to them in this project. And the single most important thing is connecting to people and working together. So it's the connections and the synergies that are created through this process and how people feel about it that really matters. The second most important thing is giving people confidence to participate, as this is something that can be applied in many other settings beyond the project. And lastly, creating change in whichever way is meaningful to people. So now we want to pose a second question to you that we invite you to also share your thoughts on the chat. So we want to know if you would consider setting up a co-design scheme for transport innovation in your municipality. And we want to know if you do, then why? And if you wouldn't, then we also want to know why. So that was the second bit. And then the final bit that I want to share with you today has to do with the practical strategies that we're using right now. And what we're doing right now is we're piloting our methods in 7 cities. So in Bologna, Brussels, Cagliari, Sofia, Stockholm, Lisbon, and Zagreb. And each of these cities comes with its own unique landscape and varying levels of experience with this kind of work. So the fundamental thing for us is really about kind of ways to localize our methods accordingly. So in applying our methods, we start off by acknowledging that there are no formulas to co-design, but rather the work is really to localize our methods so that they are relevant to the specificities of the people, time, place involved. Our strategies can be shared across cities, but they always require the tailored approach that contextualizes our processes to make them relevant to the groups involved. Each city has made explicit their identity and a vision for what they want to achieve in the duration of the project. And in doing so, this guarantees that the project prioritizes and drives the changes that these groups want to see happen in their cities. Now, going back to those 3 questions that we asked about co-design, co-creation, and co-production, I want to share how we put what we heard into practice. So to reiterate, to those participating in the project, co-production is about whose voices are heard, doing it together, and having a common goal. And the way that this translates into practice is through a working process that emerges from the realities of each group. And this entails embracing variation between the groups whilst nurturing what they share, a drive to improve public transport for disabled people in their cities, and an appetite to connect and learn from each other. So continuing to translate what people have told us into practice, what co-design for real looks like is centered on tangible actions that come from processes where ownership is co-owned by disabled people. And to put this into practice means focusing on locally informed responses to localized challenges that reflect the conversations they come from. And this demonstrates that people are being listened to from beginning until the end. And this also allows each city to explore their own paths, making the process their own. So in this project, what people deem to be the most important thing are the connections and the opportunity to work together to build up the confidence to participate and how this process affects their lives and their cities. So putting this into practice, we've been paying special attention to nurturing this exchange between groups, creating local communities that can hold individual, regional, and national goals. And lastly, the most valuable output of the project are the connections and synergies that are created through this project and how people feel about it.
Elvia, can you move to the conclusions, because we are
sure.
Very quickly. Yeah,
we're compensating. We're kind of doing this in 10 minutes rather than 20. So the things that I wanted to share are essentially more practical ways that we have found ways of creating practical strategy in 7 different cities and making them work for their specific needs. And this section in particular, which I now will probably just skip over because there's no point in just rushing through, is more around the challenges that we found and the strategies that we implemented to overcome them. And this is all really very practical things. But I will just skip over this and move to the conclusion to say that there's 3 things that we would like for you to take with you. So the first one is that inclusiveness requires relentless inclusion. And this means engineering a project to prioritize the engagement of people as equal contributors all the way from the beginning until the end. Second, keep your processes grounded in the needs of the people involved and in the project. And this means creating processes where disabled people co-determine the priorities of the project and ultimately hold agency and decision-making power. And the final point is that we can help you figure out how you can use the learnings and the resources that we've created in the project so that you can overcome these barriers in your cities and your project.
Thank you very much. We have plenty of opportunities for.
Okay. Yep. Thank you very much. I think I like the process approach that you have described, and you are now already in the demonstrations, or it's under design at the moment. That's not entirely clear.
Yes, we are in the middle of the project. So at the moment we have agreed the project briefs for prototyping in the 7 cities. One of these, for example, has to do with the intelligent transports, intelligent bus stops that we heard. Other solutions have to do with accessible travel planners, hence my invitation to work together with the speakers of the previous presentations. But we have many other opportunities for engagement. So, for example, Ivo, we put this mobility divide index, which gives indication of how we can provide information what municipalities should do in a particular bus stop to do exactly what to make it accessible. So we always use work from the viewpoint of the user, providing solutions rather than the viewpoints of the transport authorities or municipalities. So we provide a bottom-up insights on what to invest on, basically, to make their lives much better, because we can't empathize with them, really. We need to listen and listen more carefully, perhaps, than other occasions.
Yeah. No, very interesting, and it's also you give us the channel so to follow you, and I think indeed this idea of adding new solutions to the discussions that are happening in the sites. We're happy to help there. I think also the relation with INDIMO is can and Dignity can help there as well. I also want to I link this to the position we have taken in the current discussions on the urban mobility framework. So as you might know, the Commission is drafting a new plan for urban mobility for the next decade. And last week's deadline for input was answered by Polis with a position document that also includes a specific section on accessibility, inclusivity, which also links with the stories we've heard today, that we believe that inclusivity must be a key determinant for innovation, that we want to respond to the rights and needs of all users, also in line with the issue of delivering a just transition view of climate change. And we've also listed a number of actions we hope the Commission can take in view of this. So there is also an EU policy relevance here. I'm not going to read the full list of actions, and there are more in the position document, which you can find online. But for instance, one of the things that I'm following a bit away from the public transport agenda is the discussions on the European Disability Card, which has huge implications for mobility, parking, not the least. Okay, this brings us to the end of this session of the Public Transport Lab series. I would like to thank the speakers, Elvia, Tali, Robin, Françoise, Stefan, Huub, and Floridea. I hope the discussion continues also between the speakers and between the audience and the speakers. You have all received the contact details. You will be also receiving the link to the recording and to a summary of the discussion. We also would like to highlight the next meetings in this series, some for Polis members only, and some for everybody, and you'll find the dates of the next public events on this slide for November and 9 November. So that's the plan. Yeah, let's stay in touch, and we hope you found it interesting. Okay, that's it for now. Thank you, speakers, and thank you, participants. Bye.
Bye.
Thank you, Ivo. Thank you, everyone. Nice to meet you as well.